As of yesterday night, the Nigerian Center for Disease Control confirmed there are 51 cases, 48 active cases, 2 cases have been discharged, and 1 death reported. It's uncertain times for all of us, and as frontliners, we are following the WHO's recommendation on reducing our risk of being infected. And the hospitals, as well as the healthcare stakeholders, coming up with policies to reduce the risk and allow clinical services and essential services to. But we're also at that point where we are prioritizing cases, what clinical cases need to be tended to, and those that can be delayed. So the effect on cancer care in Nigeria, it's worrisome, but some patients will not have access to care because they already live too far from the hospital. And in light of the roads in which they travel on, there are law enforcement agents in place. Transportation and access to the hospital may be reduced. Treatment itself being prioritized to what is actually important. Some hospitals are not able to take on new cancer patients for treatment. And some patients are already staying back at home because they are worried about being infected with COVID-19. The effect on cancer patients likely be negative. How much cancer patients will be affected, how many cancer patients will be affected is what we can't determine. But our practice is definitely changing, and some patients will simply not be able to access care or continue care in this uncertain times. Our response should be to communicate a clear message to our patients and those affected by cancer. Number one, explaining the importance of not being infected and encouraging our patients to self-isolate because they already are a vulnerable group. 2 would be for hospitals, clinicians, and health stakeholders to come together and decide the best way forward on how we want to treat our patients. The third would be to, in this uncertain times, our patients and their caregivers are anxious. We have to create a clear path for communication, and we need to transition some of our clinical services like counseling, providing information, answering questions, allaying the affairs. We have to transition all of that online and promote digital health platforms for this communication to be smooth, as well as limit physical interactions amongst patients and the caregivers. The goal is to reduce the number of patients who walk into clinic, and we can achieve that using telemedicine. It would also be for the healthcare providers, oncologists, and all the other oncology professionals to be up to date on how to reduce their risk from the COVID-19 infection, and to be trained on how to respond to this. There's a lot of resources out there. And, even though we don't have enough data to determine the best way to treat our cancer patients, it will be to read up everything, discuss it, and then take a position on the best way to care for our patients during this time. So there are many digital health initiatives going on by the government, by the private sector. it's important that people who have cancer patients and those affected by cancer who have questions should please send their questions to www.oncopadi.com. And we have oncologists online ready and prepared to answer questions related to health cancer patients.